Okay, before we get started with the actual demo, there's a couple of things you need to know about the gingival retraction. There are three types of gingival retraction. There's mechanical, there's chemical, and then there's surgical, okay? There's also three different types of mechanical retraction. The first one is when the retraction cord is placed around the tooth, okay, to pull back the gingiva. It's tucked in there 1 to 3 millimeters, and it's left there for a while so that it will pull back. The second one is accomplished by lengthening the temporary crown, meaning, we talked about in making temporary crowns, you want to have a good gingival margin. So here what it's saying leave it longer so that it actually sits on the gingiva. So you're almost like you're actually traumatizing the gums to push it back, okay, mechanical. The third one is when another method is using a dental dam clamp and a dental dam to displace the tissue. So you're going to use a dental dam clamp to actually clamp on and kind of pull back. It's almost like a medieval type of medieval torture to kind of bring back that retraction. The second one that we're actually going to be using today is going to be the chemical one, and it's almost like the first one for the mechanical, which would be the cord, and it has it's impigmented with epinephrine or aluminum chloride, okay? So it's already in the cord, okay? And that chemical helps stop bleeding, and it also helps retract the gum from the tooth so that you can allow just enough retraction so the material can go in deep enough so we get some good marginal seals when the crown comes back, okay? And of course the third one is going to be your surgical retraction, and that's accomplished by using a surgical knife or performing electrosurgery, and that's usually like done with it's like a little cauterizer, and you can go back there and just kind of burn off the tissue, okay? So I'm going to zoom in now so that you can see what we're going to be doing. Okay. One of the things that recommended, of course, it always just varies, but it says that if you're working on an anterior tooth, you always want to use your small finger to measure the cord, okay? And if you're working on a molar or premolar, depending on which one you're using, you'd want to use a larger finger. So instead of using the regular pinky for an anterior, you would use a larger finger for any of the other teeth. Now, that's kind of the rule of thumb, so to speak, but everybody's hand is different. My pinky may be totally different from someone else's, okay? Since I'm working on number 19, okay, number 19, what I'm going to do is I'm going to measure it against my finger. It should go around. Once it's around, I take my crown and bridge scissors and I cut it. Alright, so now I have my cord, and I'm going to put it in a little well that also has pellets. The type of dunce that we'll be using are going to be the ones that have it's an older one. These are older models, and they have rubber gums. Okay, so you won't be using the regular ones that we normally do. Okay, all right. Put that right over on that side. Okay. One of the things it talks about when you're reading your competency, it talks about how the cord is looped around the margin of the prep tooth, tightened slightly. Okay, this aids in slipping the cord into the sulcus area. It normally ends the cord towards the buccal, okay, towards the buccal for easy access. So you're going to take your cord, you're going to loop it into a V, is what it says. And you're going to place it around the tooth. Of course, you got to remember that the cheek's there, okay? The cheek is going to be there. So you may need to place it around there. Use your mouth mirror to make sure you've actually gone around. Okay? You cross these over, because you're going to cross them. Okay? Then you take your packaging cord and you gently, and notice how I'm trying to work right through the inside of the mouth here, towards the front of it rather than going through the cheek. You gently use your mouth, keep your mouth mirror so you can see, and you're gently going to tuck in. Remember, you don't want to go too deep, okay? It'll tell you that, let's see, if you go too deep, and that's on page 712, where it actually shows you where it should be. Okay, it says if you go too deep, then it'll close at the cervix. If you go too shallow, it won't go far enough. So 1 to 3, you make sure to go right in the inner proximal, and you're gently tucking. Now remember, the patient will have had their anesthetic already, so they should still be numb. Okay? In front is where you cross it. Let's go back over here. And it does say that it does loop, and this is where it does cross right in the facial part. Okay? And it also tells you that you could have 2 pieces. One for, tucking under, and one for the top part, the top, which would be, of course, you'd have one that goes under and then one towards the top. But if you have it long enough, you don't need actually 2 pieces, because you can use that same one to deliver that same concept of 2 pieces. If you do use 2 pieces, okay, you need to make sure that you take out 2 pieces at the end, okay? So you now leave the little pieces hanging out. You'll leave one, and it usually hangs out, I think it says, towards the buccal, okay? You want to place it and leave in there for 5 minutes, okay? And if you're using, so we're using chemical, so it's for 5 minutes. If we were using mechanical, and there's no, epinephrine on in there, so you'd want to use 10 to 15 minutes, okay? Another thing that sometimes you'll see the doctor use, you'll see them use little pellets, okay? And a lot of times these have it'll have some type of chemical, okay? And they'll put it right in between. They'll put it right in between the contacts. Okay? It might have more epinephrine. Sometimes they have this, it's like a hemostas. What is it called? Oh shoot, what is it called? It's coming to me. Has hemostat on it. Okay? So I put in 4. So I want to make sure that I have 4 in here, that I have them packed, and these are going right in between the contacts, because sometimes that's where bleeding occurs. And see if you can zoom in. See if I can zoom in a little bit more. Okay, and after you've tucked that in, we know it's going to stay there for 5 minutes. Lots of times you'll see the doctor, and what they'll do is you'll take a gauze, you'll fold it into 4 like a little pillow, okay, and they'll place it over that, and they'll have them bite down to wait out those 5 minutes or 10 to 15 depending if it's chemical or mechanical. Okay, this is my gauze. It's actually a tissue, but you want to use gauze. Okay, and they have that, they'll hold that. Okay, and the reason why we put it too is so that they have something soft to bite down, and also so that they can keep from, you know, putting their tongue in there and tasting it and moving the stuff out. Because when we take it out after 5 minutes, you want to make sure you take 1 gauze, and then you're going to count. You're going to count 1, 2, 3, 4, there's 2 in there, and then I'm going to come in here, and with the little tag that I left out, okay, we're going to remove this in a circular motion, and you'll count to see if you got all your cord, if it was 1 or 2 depending on what you placed. Okay, now since we have now removed that, the gum is now retracted. We'll show you how the gum looks. You can see the separation. Sorta. You can get it stop being blurry. Come on. It's right there. Focus. Too many things there. Anyway, too many things to focus on. Okay, well, I will focus on this down here so I can zoom in and get sharp. Okay, let me move this out of the way so it gives one thing to focus on. Okay, there you go. I'm going to leave it there. So, things we learned. 3 different types. Mechanical, chemical, and surgical. Mechanical has 3. One that has the cord without the epinephrine or the aluminum chloride. Okay. The second mechanical is the leaving of the temporary crown a little longer. And the third one is the dental dam clamp. Okay. With the chemical, again, we talked about it's with the cord, and what else? It's the cord with the epinephrine. Also, there is one that's a chemical, and let me find it really quick. It's on page 1712. Let me see if I can get this in here. And it's another form of chemical, and it's called expansol, and it's a type of chemical that you bring out, and you can see it on that page. It'll tell you. It comes out as a form of a gel, and then it foams up, and that is used instead of the cord for the chemical one. Okay, and then the last one is the surgical that we talked about, which was you can either surgically use a surgical knife or the electrosurgery, which is that cauterizer. Okay?